Good morning. My name is Jeffry Watson. I'm one of the orthopedic hand and upper extremity surgeons here at Colorado Springs Orthopaedics Group. We'll be discussing various orthopedic conditions in the hand, elbow, wrist, forearm. We'll go over who gets them, why they occur, and a little bit about the anatomy of them, and then most importantly, what's on the menu, as I like to say. What are your options? Once people know options, it helps them to understand and perceive their problem better. So we'll go piece by piece through a number of different topics, and I look forward to seeing you then. Both of these conditions, they often go away if you never see a provider. But some people keep having this nagging problem. And it's quite controversial what the best option is for this. A lot of patients come into me with a month of this and they want it to go away right then. It doesn't go away that fast. For these two conditions, actually we're slow to operate on them for a good reason. One, they usually will get better with non-operative management. Two, we're not that thrilled with how they do after surgery. Our non-operative options, you won't ibuprofen your way out of this. You're not going to take enough anti-inflammatories that's going to make this get well. Occupational therapy or physical therapy, there's modalities that therapists often use. Most of them are aimed at trying to get better blood flow to that local tendon in the area and help you to heal it. The MRI doesn't help us very much. Many people will come to me with an MRI that's been ordered and that shows a tendon tear. We don't really care about your tendon tear because a lot of people will have that same tendon tear who don't even have this problem. It doesn't tell us what to do. It doesn't tell us how you feel. So the mere presence of how it looks on MRIs doesn't tell us what to do for you. Sometimes if someone is really dysfunctionally painful, where they can't sleep, every time they roll over at night it's waking them up, their daily function is so bad, we'll use a local steroid injection to try to palliate their symptoms. And that often works. It often knocks their pain down for a while, but it doesn't cure the underlying problem. It doesn't make the tendon heal. So again, your doctor will often try to do that for you to help you with pain, but he or she is not curing you. Other modalities, you'll hear people getting platelet-rich plasma injections. Platelet-rich plasma is your own blood, basically. It's your own stuff. There's no disease transmission from it, but it's your own blood that is centrifuged and separating it into layers. And the layer that has the platelets basically has a high it's not the platelets themselves, we're not talking about blood clotting, it's the proteins that are mixed in with that. It's very controversial as far as how effective it is, but there's some evidence suggesting for tendinopathies like this, it can help the tendon recover. This is something we take very much on an individual basis with patients, depending on how long they've had it, what their needs are, and we will go over these same areas with you in a clinic visit. It seems like such a simple problem, but as you can hear me talking now, there's a lot to cover when people are in a lot of preconceived notions that we have to unravel about this condition, this very common condition, both of them, when people see us in the office. So we'd be happy to see you here and talk about it then.